Hey guys, welcome back to the series where we are building a transplant coaching platform in public. It's a full SaaS product from 0 to 1 million. In this series, we go over the Q&A we get asked all the time by patients, by customers in the community, social media, or who book through our consults. We do some building in public where I share with you what we were working on last week, what we've done, what we're going towards, and what we're working on for the next part. And I as well show screen share our numbers of followers, our stats, who we helped last week, who told us to go pound salt, who was thankful, and everything in between. So stay tuned. All right, guys, let's dive in. A lot of exciting stuff that's happened since the last video in this series. And let's go ahead and walk you through all of it. So let's start off with some Q&A that we've gotten over the past couple of weeks. We had a consult last night, which was in our exact demographic. Wonderful couple. They had been listed at an 8-year wait in Los Angeles, California. California as a whole has quite long wait times for organs. And they were struggling. They were like, how can we, I can see my husband's health is deteriorating in real time. How can we address this issue? And so we go through the whole consult, right? We go through all the commonly asked questions. We go through the platform. We're like, okay, there are these green dots. We can find, there's less than 2 years waiting at many different places we can send your husband to. Great. They love the service. And she asks me a question at the end where she says, well, this is all great, but there's two questions. One is, how can we trust you? It's totally fair. And the second is, if this works so well, why is no one else doing it? And it's such an obvious thing that it almost made me laugh a little bit, because the first part is, how do we trust you? Well, that's hard, right? Health products in general have a very high requirement of trust, especially this value proposition of, let's move you from an 8-year wait to a 1.5-year wait, save 6.5 years, possibly more, since this gentleman had already accrued, her husband had already accrued a lot of wait time on dialysis, which is transferable. That's a big value proposition. Well, testimonials, video testimonials, and written testimonials, I think, are the best we can get. My profile is fully verifiable online, who I am, who I say that I am, as well as my co-founder. And we've both been through the process ourselves. So aside from me physically showing up to their house and sitting at their kitchen table to have the discussion, we have to use an approximation, a third-party approximation for how trustworthy or credentialized this product is. And it would be the same in any business. Health stuff does have a bit of a higher barrier threshold, as it should. And it's also because there's so much disinformation out there between different public forums where people push all kinds of garbage and therapies and things that don't work, to as well just feeling awful. It's a disease that makes you so tired and fatigued, and you feel like crap all the time. It's very hard to just get to that level, especially if you're on dialysis. It's even harder, let alone also having the trust to use a product like this. So I'm going to talk more about this in a minute, but we finally have one of our video testimonials, like I promised in the last video. I sent that over, and we reviewed it together. So it's up to them what choice they want to make, if they want to use this or not, and either way is totally fine. But trust is a difficult thing to establish in the health tech world. Now, the second part of her question was, if this is so valuable and important, this is such a big value proposition, why does no one else know about it? And I was like, I ask myself that question every day. And my opinion is it's twofold. So one is, it's not part of the patient education. Patient comes in for kidney disease related symptoms, they're diagnosed. If they're past a certain point where they need dialysis, then they're sent over to a dialysis center for treatment. Now, there's a port process and surgery that may happen in between, but that's the normal course of care. And listing for a transplant is a discussion that does happen, but even when it does, it tends to happen locally. And if you think about it, that makes logical sense. You're in this city, you're in Phoenix, Arizona, or New York, or whichever. You go to your local primary care doctor, you get sent over to a nephrologist, to the kidney specialist, and at a certain point, you get sent over to a dialysis center. And sometimes you get sent over to the transplant hospital up the street. So that process makes sense logically, but the problem is, if you look at this map, you can see all the red. So for most people, they're being sent to hospitals with 5 to 11 years of waiting time, places they're very unlikely to ever receive a kidney. So I think it's an education gap. It's not part of the standard treatment of a regimen of care. And then on the other side of that, it would be easy to sit here and say it's the doctor's fault or it's the insurance company's fault, but it's not. It's this perfect storm where it's not possible for healthcare staff in one city to know all of the rules and regulations and policies of every other hospital in every other state in the country, because they change. There's uniformity between them, but the risk tolerance of what they're willing to take on changes patient-wise, and how long you wait for an actual kidney is not common information. This wait time map tool that we've built is the only source of knowledge for wait time that I've come across. Now, srtr.org, the government entity, does a really good job of breaking down hospital by hospital and the quality scores of each. They have a lot of great data and statistics, but they don't specifically forecast the wait time, at least not as of this video recording. I hope they do at some point. So that's why we're working so hard to make social media content and to pay for Google ad space to get the word out that multi-listing is an option. So instead of going over the regular Q&As, that one stuck out to me, and I thought that would be of value to you guys as well. Now let's go into the numbers. What do we do since the last video, and what's changed on the social media side and the paid side? So for social media, we've posted 62 videos in the last week, which is about 20 or so unique videos across the 3 platforms: Instagram, YouTube, and TikTok, which is right on pace. We want to stay at that comfortable range of around 20 or so new videos per week, and we'll increase them over time, but we don't want to do too much too fast and lower the quality of them. We want them to consistently be good, where we give tactical step-by-step instructions on how to multi-list, on how to better prepare for dialysis, and we mix in some more abstract concepts in there about dialysis, about the myth behind multi-listing, and it's a combination of those. And this is great. We get leads every week from it. People just directly see the content that go over to the website, and that brings us up to 384 video posts in the last 90 days. Followers continue to increase. And for us, it's pretty much just TikTok. Now this I found interesting. I think you guys will too. And that is our stats of who looks at the content. And I think we're right on brand here, because if you break down our demographic, the average age of kidney disease in America is in the early 40s. So the idea that we would have 78% of our viewership be between the ages of 45 and 65 is excellent. I think it's right on track. And we're even starting to capture some of the maybe pre-kidney disease patients, or folks who have been diagnosed with kidney disease, but they aren't at the point of failure yet. They're just trying to do some preliminary research before, to get ahead of managing the disease. Now, of course, we have some exceptions. Like I was 25 years old when I received a transplant, so we do see some of those folks too. But that's right on pace. The male-female split's about half-half. Kidney disease does skew a little towards the male side more than female, but we do see both. And we see an even split also because if you think about the most likely caretaker when someone has kidney disease, whether it's the man or the woman, the significant other, or the spouse, is probably going to be the caretaker. So we try and make content that as well appeals to the caretaker side of things, because that's its own job, and it's a lot of work, and it's not an easy feat. As far as geography of viewership, 80% plus US, we want this to be a little higher. It's certainly no problem for the rest of the world to learn about multi-listing, but our content is specific to the rules in America, so we try and focus more on the American geography. So that's the social media side of things. Now let's talk about the paid ad side of things since the last video. We use both. That's sort of our combination here. And these are simple search ads. You go to Google, kidney transplant wait time by state, or kidney transplant faster, and we bid on those keywords to show Transplant Coach. Say, hey, check us out. We do that with 2 main campaigns, which is a search campaign here and here. They're both just made a little differently. But these are our main campaigns, and we like to see it. We have a click-through rate of between 9.5% to 12.5%. So people who clicked the ads and got all the way to the page and read our stuff. 9 to 12 is great for where we are right now. Google has a learning period where you're really not supposed to mess too much with the ads for the first 20 days while their algorithm learns how to best find your audience and then what ads resonate best with them. As of Friday, November 7th, I can start tweaking stuff again because the learning period will be over. And we want to get this CTR rate up to like 20%. That's our goal. Our wrapper campaign, this is only a campaign to test different headlines. And the stuff that resonates the best, we pluck out and we put into the main ones. And then lastly, we have a retargeting campaign, which means if you checked out our stuff within 30 days following, you might see an ad for, hey, by the way, if you're still interested in Transplant Coach, we're still here. And that's our paid ads side of things. After our learning period is over and we get our CTR up to 15 to 20%, then we can start putting a little bit more cash in. Now, the stats as well for how we did since the last video, we've had about 10 consults, which have been a mixed bag of, I saw your post on TikTok and I saw your ad on Google, had about 10 consults, 0 purchases as of the recording of this video. About 4 of those 10 were are now higher information buyers because they've had our consult together and may purchase. We'll see. It's a big decision, and we're not naive to that. I don't even think it's about the money for most people. I think it's about the mental decision to choose to multi-list. So more to come on that. As we get more mature and we have a more established funnel, I look forward to sharing with you guys, here's how many appointments we got booked in this period, and here's the mix between social media versus paid, and of those, who showed up to the consults, and then who bought the service. I'm very excited to start showing that to you guys. Now, in our last video, I promised 2 things to you guys and to myself, and that was one, that a testimonial video would be produced and ready to go on the site. One that came in from a couple who used the service about a year ago, and from the time of their listing at the hospitals we sent them to the transplant was 3 months. 3 months after this gentleman had been waiting for years. Huge win, and we've had many of them, but not all of them produce video testimonials. So we were excited to see that, and that's over here. Carlos and Christina, which you can now see on our homepage under our testimonial reel, and you can also see under success stories. Boom. Big front center, and we will add more as we're able. And he goes through the whole story, how he found us, what they liked, what they didn't like, and what the result was. So we couldn't have asked for a better review. Not just because they're saying positive things, but because they show the entire process. It's like a 4-minute video. Their entire experience from start to finish. And we were just a part of it. The second thing that I promised is a video sales letter. And we've done it. It took a lot of recordings, a lot of work, but we got there. And this video sales letter is so important to us and to our users, because if we take a step back and we look at just business principles in general, we don't look at people as, are they going to buy or are they not going to buy necessarily? We look at, there's this entire pool of people who could see our stuff, no matter how we reach out to them, whether it's paid ads or social media. There's this pool that exists of people who would buy our stuff, but their purchasing decision relies on how much information they have. So it's actually a continuum of low information buyers to high information buyers. And everybody in any business, not just ours, gets the low hanging fruit sometimes. Let's say we get them to people who maybe they work in healthcare. They already know the system, they know us, they know what we do, and they just show up, they're like, hey, I want this package, let's get it done. Cool, that's great. We love it, right? We love those. But that's not sustainable. That's not what takes a business to where you want to go revenue-wise or user base-wise. So what that means is, how do you inform this pool of people? How do you make sure everyone has the correct level of information so they move from the left side, which is low info buyers, all the way to the right side? And this is not my principle, by the way. I didn't come up with this. People much further along than me have, and over the years I've applied this, and we've gotten good results from it. So let's say it takes one of our customers 1 hour of consuming content about Transplant Coach and about multi-listing before they're willing to make a buying decision. Well, if I just pumped out TikToks that were 60 seconds long, a minute long each, and it takes each one an hour, that means any customer would have to see 60 different TikTok videos to be high information to make their purchasing decision, even before they meet me, if they're going to buy or not. That might take someone a year or 2 years. So instead, we want to compress that time frame So from the moment any customer from that pool walks into our ecosystem and decides to book a call with us, to meeting with us, we want to condense that time frame from a year down to a half an hour. And we do that through a video sales letter. This video sales letter goes over all of the questions and objections that hundreds and hundreds of patients have had over the years for, is this service right for them? What are the commonly asked questions from, is this going to affect my listing currently? Am I going to have to move? What's going to happen with my insurance? Am I going to have to take drugs forever? All of the questions that I've gone through personally and over hundreds of consults I've taken, we've condensed that into this video. And it's excellent because it takes this pool of people who could see our stuff and gets them to that purchasing decision of yes or no by the time they meet with me. Because we're of the belief that it's not our role to sell anybody on using Transplant Coach. It's our role to be there to answer all of the questions that they might have, which we've done in this video. And if there's any lingering questions, because people are unique, right? It's not a one-size-fits-all. So when you get to the consult, you've already made your decision on if this is right or not. And if it is, we can review a couple of additional questions you may have. Maybe there's some questions on the premium tier or the platinum tier. And we can finalize and get you scheduled and get you multi-listed. It's a much smoother, more effective sales funnel. And maybe we'll find that 16 minutes is not enough. Maybe there's extra questions I missed or concepts or objections. So we'll have to add to it. And we'll keep adding to it and make every single person watch it before they meet with us. That'll make our operational burden a lot less, because people who have decided they're not going to use the service because, let's say, they're not going to multi-list at all, they probably won't show up or they'll probably cancel. And that's totally cool. So we're working with more of the people we want to work with, and customers are not wasting their time if they don't feel this is a good fit for them. So this is a big win for us, and I'm excited. If you guys want to see it, just hop over to the page, maybe, or you can just use the link here. Very, very excited. Also, as we wrap up this video, if you guys have any questions on the kidney side or on the business side, just comment them below and paste them below, and I'm happy to review them in the next video. So I want to say thank you, as always, for giving us your time and your attention, and we'll see you in the next video.